everyone. Welcome to the Smart Women Savvy Money monthly podcast series. My name is Derenda King, and I am one of the financial advisors here at Urban Wealth Management, where we focus on helping women get their financial lives in gear. If you are tuning in for the first time, thank you for taking time out of what is a presumably very busy schedule to tune in. And if you are a returning listener or if you are already a part of our community, we thank you for taking time to tune in yet again. For those of you who are first-time listeners, our podcasts provide both financial as well as lifestyle information. They're designed to be short, yet informative and impactful. We offer them 11 times out of the year, and so the only month that we don't offer them is during the month of December. And to view our upcoming podcasts as well as other events, we encourage you to take a look at our website and click under the events tab, where you'll see what we have coming up. And as you can see here, in the month of September, we'll have a podcast on college planning, which incidentally I will be hosting. And then finishing out the year, we'll have guest experts sharing pertinent and valuable information on impact and sustainable investing. We also encourage you to take a look at our blogs. We provide quite a bit of content, many of it written by our advisors here. And as of late, we've been providing quite a few tips on how to navigate all of the uncertainty during the pandemic. Many of our blogs are also written by our guest host. And in fact, we have one written by our guest host today entitled Caring for Elderly Loved Ones. And so we encourage you to come back and read that at your leisure. So with that said, we are constantly updating and adding content because we want to make sure that we're providing both relevant and beneficial information to you and your respective families. And speaking of beneficial and relevant content, today I have the pleasure of introducing Loli Ramezani, who will be sharing information on elder care options for your loved ones. Loli is the president and owner of Always Best Care Senior Services in Manhattan Beach. And her company provides full service senior care, including in-home care for the elderly, as well as a complimentary placement service for assisted living communities. Loli has also been a speaker for Alzheimer's Los Angeles for the past 4 years. And she also holds a support group for families that have loved ones that have been diagnosed with Alzheimer's. And so without further ado, Loli, I'm going to go ahead and turn it over to you.
Thank you, Derenda. Thank you, Derenda and Urban Wealth Management for this opportunity. And we will try to share my screen. Okay, let me, oops. Okay. Okay. Okay, so in year 2030 is going to mark a historic demographic change in our country. That is the year where baby boomers, those who were born between 1946 and 1964, all would have been turned 65. And that particular year, for the first time in the history of our country, the number of the elderly is going to be larger than the number of the children in our country. In addition to the baby boomers aging, the advancement of medicine and technology has allowed all of us to live longer lives. And as a result, our country is aging and our population, aging population needs care. Another statistics I wanted to share is that in year 2040, basically 1 out of every 5 American would be age 65 and older. Our lives have not been normal during the past few months due to the pandemic. COVID-19 has not only affected individuals that have underlying health conditions, but it also has had a negative effect on our elderly. Now, getting old by itself is not a bad thing, right? Because the alternative is death. So we do need to embrace our elderly and our aging population, but we also need to be prepared both as individuals, as a community, and on a larger scale as a country. We have all heard about the news about the outbreaks at the nursing homes when there's a congregation of quite a few people, many of them elderly, who have been there for various reasons. And that would be a good segue to the topic of our conversation today, which is basically how can we live safe and healthy in our older age. As we age, even for the healthiest of us, some of our physical capabilities will diminish. We may have issues with our balance due to arthritis or other joint or muscle pains. Our hearing or eyesight may not be as good as we were younger. There may be issues with continence, being able to go to the bathroom, or mobility in general. So and then we go to the other extreme, which would be the individuals who may be suffering with some cognitive impairment due to Alzheimer's, Parkinson's, or any other kind of dementia. And in order for us to be able to continue a safe and healthy life, we would need some assistance. And that assistance can be provided in what is called caregiving. A caregiver would basically allow the individual live independently, safely, and healthy longer. A caregiver, you can look at a caregiver for somebody who is more of on the independent side as an assistant that would help them with their what is considered the activities of daily living, or ADL. Those are basically each one of us. As we get up in the morning, we get out of bed, we change, we go to the bathroom, we brush our teeth, we have breakfast, we may take a shower. That particular date, we want to walk, we want to make sure we take our medications, and all of those particular activities, again, as we age, could become a little bit more challenging for many of us, and those who have more issues, more physical issues, chronic illnesses, or any type of a cognitive impairment, becomes a very big challenge to address any of those requirements. And as such, receiving some assistance would help the individual to have more control over their lives, irrespective of their place of living. Now, caregiving can be provided through different options. One option, as many of us would be familiar with, would be if the family members or a friend is providing that caregiving for us. So if we have a spouse that lives with us, or if we have children that either live with us or they are able to visit us on a regular and consistent basis, they could provide assistance with some of these services that I talked about. Obviously, their love and care is very important emotionally for the elderly and for the family member. But a couple points that we want to keep in mind when it comes to family caregivers is, with respect to their level of care, is that on one hand, these individuals, more likely than none, have their own personal lives and activities, so they may not be as available as is needed. Their availability may not be as consistent as is required. And also, due to other personal activities that they may be engaged with, they may not have rightfully all the patience when they are dealing and working with the elderly to assist them with their activities. In addition, family members may not, because they are not professional, so they may not have all the required skill sets or even the communication skills to be able to manage their communication with the elderly loved one, to encourage them to do the things that is right for them. And this goes all the way to the state where if the individual has Alzheimer's or any type of a cognitive impairment, again, managing that relationship and that communication becomes something that people need to be aware of. And as a family member, we may not be equipped with all those right tools or skills. The other side of this that I want to emphasize, and unfortunately having been in business for about 8 years now, we see this more often than none, is that as family members, we normally don't look at ourselves as caregivers because we love the individual so much, and it is part of a personal relationship. So we may end up getting into what is considered a burnout situation, where we are not taking care of our own personal needs. And if that happens, then we will not be able to live safe and healthy ourselves. And not only, obviously, we need our health in order to be able to care for our loved one, but more importantly, as an individual, we need to be healthy so that we can have a quality life. So then the other option will become, if the family caregiving is not as available or is not as practical, then the other option becomes hiring professionals. Companies such as ourselves, we have caregivers. The caregivers are basically assigned to the client based on the client's care needs, the schedule requirement, and also the availability of the caregivers. And the caregivers would perform the exact same tasks. The caregivers can be at a house with the client anywhere from a few hours a week to 24 hours a day, 7 days a week, again, depending on the needs that the individual would have. One other point, going back to the family situation, I wanted to mention is that, as I indicated earlier, sometimes a spouse would be the person that is caring for their spouse. And even though in that type of a scenario, the relationship itself is very loving and it's very inspiring, but from a practical perspective, if you look at it, we are expecting an elderly individual, maybe someone in their 80s, to care for someone else who's in their 80s and 90s. And each individual could have their own balance issues. They could have their own limitations due to their old age. And that expectation puts a lot of pressure on both parties. We know accidents happen when we least expect them. So that scenario could expose both individuals, the couple, to difficult situations. And that is something to keep in mind and be able to manage the situation through other channels. So the caregiving option that I talked about here, as we noticed, it is for situations where we are staying at home. It is considered age in place. So we live at our own house, at our own home, or the place we have lived, for all the earlier years, and we just provide the assistance with our daily activities. So that is one option. The other option that is available right now is for the individual to move outside the home. Sometimes home may no longer be the best place to live for various reasons. One could be the health and safety reason. For those who are suffering from Alzheimer's or Parkinson's or any other kind of dementia, their security and safety becomes a priority. Many who have Alzheimer's could be considered as what is called wanderers, when they may open the door to the house, leave the house unexpectedly. And so for someone in that condition, staying at home is not a safe option. They need to have someone who is watching them 24 hours a day. Again and again, that may not be a practical solution considering the family situation for that individual. The other health and safety and the health factor that could come into play is that even for those of us who do not have cognitive impairment, we may live in a house where it has 2 or 3 stories. We have to get up and down the stairs every day to get from the bedroom to the kitchen to the bathroom. And if we have balance issues, if we have any type of a joint muscle pains, any type of an arthritis, getting up and down the step could be a difficult thing, and it could very much, not only it could limit the individual and their movement and mobility, but also it could be a cause for accidents. The risks of fall would increase in that type of a situation. According to CDC, Centers for Disease Control and Prevention, 1 out of every 3 American falls every year. Some of them move, they have to be transferred to the hospitals due to the surgeries that they're requiring. And some from the hospitals, they have to move to the nursing homes due to rehab process for physical therapy, occupational therapy, speech therapy, again, depending on the condition. And unfortunately, many do not leave the nursing homes, and the nursing homes end up becoming their final home, mainly due to other complications or infections that they may be exposed to. That situation becomes even more critical as we look at the current conditions where under the COVID pandemic, due to very strict guidelines and rules, the individual that stays at the hospital or at the nursing home cannot be visited by anybody from outside in order to slow down and stop the spread of the pandemic. So that factor by itself could cause isolation for the individual, being in a different, strange environment, if you will, outside their place of residence for a period of time. So the whole purpose would be, again, all of the options we are talking about as far as the caregiving is to put preventive measures in place so we can stay healthy, so we can avoid the risk of fall by having some assistance at home or at our place of residence, wherever it may be, so that we can improve our quality of life, basically. So I talked about the one factor, one reason why home may not be the best place. We talked about the health and safety issues. The other could be financial burden. If the individual requires 24-hour care, the cost of 24-hour care when it is performed by one caregiver for one client is normally higher than if the individual were to live and receive that level of care in a group setting. So financial burden could be a factor. And then the other element is isolation. If our spouse has passed away and a spouse that we have loved for many years and we lived together, and the individual is at home by themselves, that isolation could actually cause depression. Even in those scenarios, sometimes depending on the individual and their personalities, their health condition, having a caregiver with them few hours a day may not be enough as far as the companionship that they would require. And so if the individual is isolated, then they get depressed. If they are depressed, then they may resort to alcohol. Many of us in our older age, we are on many medications. So the combination of the medication and the alcohol is a very bad mixture. And all of that could lead to poor health for the individual, not to mention that isolation and depression could also lead to the individual, the elderly, committing suicide. One statistics has shown that the rate of committing suicide amongst the elderly is higher than the teenagers. So again, these are all factors that we want to consider as we are reviewing different options for caring for our individual. So what would be the solution? So if home is not the best place for the individual to live, what would be the next best option? That option would be, as I mentioned earlier, making arrangements to live outside home. And in order to live outside home, there are different types of facilities or communities, if you will, that are available. I have grouped them into two separate categories. One would be a medical facility and the other one non-medical. And I've listed different types of the communities or facilities under these categories with an intentional space between the list so that we can make that distinction. So a skilled nursing facility, or for short, is called SNF or SNF, or the other name that is used, the other term for it is nursing home. These are medical facilities. We hear in the news and social media or in common terms sometimes that the term nursing home and assisted living communities, they are used interchangeably. So I do want to emphasize and make the distinction between a nursing home that is a medical facility where individuals that move to a nursing home require some level of medical care. they may need wound care. We talked about earlier, they may be transferred from the hospital to the nursing home where they are going after a surgery, they're going through some rehab process, or there may be other complications, other medical complications that need to be cured. And that would be the reason for them moving into a nursing home. The second option, which is the option we want to focus on if we are not staying and living at home anymore, would be the non-medical option. And that is to move to what is considered an independent or assisted living community. These communities are basically, they are not medical facilities, so there are no doctors on site. Some of them may have nurses or LVNs on site during some parts of the day, again, to be able to address any emergency situations that come up. But in general, there is no requirement for a medical staff to be at these communities. All of the communities, we talk about the independent and assisted living community, always also listed residential care homes, or in California, they're also called board and care. They're all licensed through the state of California. They all provide room and board. They do medication management depending on the level of care that the individual needs. And they all provide, again, caregiving. And the ratio between the caregivers and the residents are some standards and guidelines that they have to follow through the state regulations. And the difference between what we consider an independent or assisted living community versus a residential care home or a board and care is basically the size. So a board and care is a house, and they can have anywhere from 4 to 6 residents, private room, shared rooms, private or shared bathrooms, and they can, so they would provide that level of service. And then if it is a larger community, the same concept again, but in a larger setting, then we are talking about assisted or independent living communities where there could be residents anywhere from 20 to a few hundred residents in the same building, in the same property. With the all of these communities, again, they're ADA compliant, so to allow the individuals to live till the end of their lives. So these could be a place where the individual moves, and even when their care levels change or they may improve, they may get worse due to age and other factors or health conditions, then they can actually stay in that place. So as we age, the one, I think, point of comfort for the family members, or if it is us, if we are getting close to our golden years, is to realize that we do not have to make too many moves or transfers from one place to another, because this is a place that we could call home and stay there. The one thing that also the independent assisted living communities would offer is larger communities. They're able to provide social activities, entertainments. If there are religious activities, the meals, you have options on the menus for the different types of meals. They could be outings that are taking place. And a residential care home would provide some of that to a smaller degree. In my opinion and through my experience, a board and care would be suited more for individuals that maybe have a lot of cognitive impairment, where activities are not really suited. They need to stay healthy, safe, and their hygiene obviously needs to be taken care of, or individuals that require a lot of physical assistance. Being in a board and care, the smaller size allows the individuals to receive that level of care versus being in a larger community. Then the larger communities also can provide the option of what is considered the memory care units, where individuals who have cognitive impairment, specifically if they've been diagnosed with any kind of dementia by their doctor, then they will be staying in that part of the property. The memory care units are secure, so the individual cannot leave the property on their own. But because of the size and the space that is provided, the resident will not feel that they're locked into a place. There's enough space for them to walk around and, to have interactions with the others, but their safety obviously, becomes number one as far as the considerations. So I think the one last point that I wanted to mention here is that how do we pay for all of these services? So the funding for these services, there are different methods that can be used. The first item that I've listed is considered long-term care insurance. Long-term care insurance is different than a regular medical insurance, be it Medicare or Medi-Cal or any type of a supplemental insurance. It is something that some people have and others may not. Long-term care insurance provides caregiving, and depending on the policy, it could provide the caregiving either at home through caregivers or at a community, an assisted living community or a board and care, or both. So the specific policy would determine as to what the coverage is, what is the financial resources that are available, if there are any limitations, if there is any waiting period, if you will, at the beginning, in order to be able to use the services. So that is something that I would strongly recommend that if you or somebody, an elderly that you love or care for, if they have this option, then it is to look into it and get the specifics about the policy so that it can help either the full payment for the caregiving or supplement that services. The one other option I wanted to mention that is a specific Veterans Administration's program, the fourth bullet down. This option is different than the VA medical benefits that are available. This is considered aid and attendance, and it is basically to provide the benefits for caregiving options for the individual. The amount of the payment they apply to both veterans and surviving spouses of the veterans. And the amount of the benefit, I believe, for a veteran is around $1,400. For a surviving spouse is around, for a veteran is about $1,700. And for a surviving spouse is around $1,400. Both are tax-free. And one of the requirements is there is a low threshold for the income and the assets that the individual has. So that is something that, again, you need to look into to see if the individuals qualify for this. But it is fair to say that there are millions of dollars of aid and attendance that are sitting on the table because they're not being claimed. So it would be a good area to look into. The other options that I talked about, I talk about on this slide, basically personal pay, retirement savings, SSI benefits, obviously any social security benefits the individual may have, the family funds and the home equity loans. All of this is considered as part of individuals' assets and income. So every time I talk to someone, if they're asking for the cost for a placement, be it a board and care or an assisted living community, and they say, well, how much is going to cost? I mean, the one thing that I do mention to everyone is that the cost of these communities could be anywhere from $1,200 a month, which is at the low end, all the way up to $15,000 a month at the high end. And the prices, all of them, again, all of these communities must be licensed through the state. They must provide the caregiving, the room and board, the medication management. But it depends, the price difference depends on, I would say maybe, a similarity would be to real estate, but in general to the location and the type of the amenities they provide, the level of care that the individual needs. So in order for us to determine what type of a community would be best suited for mom or dad or the loved ones that we are concerned about, in addition to their care needs and the location preference, the main thing is that what is the total asset that is available either to the individual or if they are family members that are supplementing the care costs. And to look at that with a financial advisor, companies such as Urban Wealth Management, Derenda, and her colleagues, to review the assets of the individual and the age of the individual, and then take all of that and their care needs, take all of that into consideration, and then that could determine, based on their age and the amount of assets that is available, what the total overall budget is going to be. And then you can divide that by months, and that could give you an estimate regarding the available monthly budgets for the individual. So those would be, the options. Again, majority of them, except for the long-term care and the aid and attendance, are personal incomes and assets that are available to the individual. The one last item I have listed here is Medicare Advantage. That is a benefit. It is not a huge benefit. The number of the hours for the caregiving are limited. The number of the insurance companies, I was reading an article this week that mentioned that there are only a few insurance companies that are taking advantage of, no pun intended, Medicare Advantage, and are offering some supplemental benefits for caregiving for the individuals. Having said that, the current condition, what has happened through the COVID-19 situation, has made it more clear for the country, and there are talks from a legislative perspective and also through CMS, that in order for us, if we want to cut the cost of the medical care, if we are able to, considering the facts that I mentioned at the beginning of our presentations, as far as the our population aging, within the next 2030 is only less than 10 years away, that if we wanted to reduce the cost of the medical care through Medicare, specifically, or Medi-Cal, we need to be able to provide preventive care. And any of those measures of preventive care, which are done through caregiving, in essence, like I said, be it at home through the assistance we receive, or at a community that is equipped with this level of service, that would allow the individual to stay healthy. So it would reduce the number of their visits to an ER due to a fall, due to UTI, urinary tract infection, which is very unfortunately common about the elderly. And the big reason for that is not being able to take care of their hygiene, again, due to mobility issues, due to incontinence issues, and many different factors. And again, all of those are elements that can be supported by having a caregiver with the individual. So if you are able to provide the benefits for caregiving services, which would act as a preventive measure, then we can allow the individuals to stay healthy longer at their place of residence, and we can then reduce the huge cost of medical care that individuals are receiving. So Medicare Advantage and an expansion on this service could be something that we should be looking for. And again, the current condition, as difficult as it has been, it seems that it has put a spotlight on this particular requirement and may move things faster going forward. And I think with that, that is the last slide that I have, and the one that I'm going to post is my contact information. Like I said, our office is in Manhattan Beach. When the office is open, we have a staff at the office during normal business hours. Outside that, myself and my care coordinator, we have our phone with us literally 24/7. So if there are any questions, please don't hesitate to contact us through email, through our website, or our phone number.
All right. Excellent. Loli, thank you so much for this wealth of information. I think it probably goes without saying that this topic is so timely right now, especially for families that may be caring for aging parents or elderly loved ones during the pandemic. And so hopefully the information that you shared will help them make more informed decisions about what would be the most appropriate type of care for their loved one. And ultimately, as much as possible, try to ensure that their loved one is safe and protected. So for those of you who are caring for aging parents or loved ones, or even for those of you who want to be proactive rather than reactive and prepare in advance, I strongly encourage you to take Loli up on her offer, reach out to her, call, email, ask her questions, learn more about her services and how she may be able to assist you and your family. And then also for those of you who are interested in learning more about long-term care insurance or even obtaining a policy for yourself, this is one of the funding options that Loli mentioned. We here at Urban Wealth Management can assist you with that, as that is one of the services that we also offer. So again, Loli, thank you so much for this wealth of information. And thank you again to all of you for tuning in. And until next time, we hope that you continue to remain safe, healthy, and well. Take care.
Thank you.